All right. So today we're joined by Dr. Charlie Hu. He is a hospitalist, um, and will tell us about his experience as a hospitalist. All right. Welcome, Dr. Charlie Hu.
Great.
Thank you
Thanks so
for
much,
your.
Con.
Yep. All right. Uh, how long have you been practicing? And can you briefly give the students a description of your job?
Yeah. So I've actually been practicing as an adult hospitalist for about 17 years now. Um, you probably already know about hospitalist. Uh, I only see patients just in the hospital. So I describe this to patients as, let's say you come to the ER and they say you're too sick to go home. That's when I start taking care of you, only in the hospital. And then once you stay a couple days in the hospital, we get you better. Um, once you're discharged from the hospital, hopefully I never see you again. That's how I describe it to our patients. So I don't see patients in clinic. I don't see patients in the emergency department. I only see patients just in the hospital. I take care of them every day while they're in the hospital.
Okay. Okay. Great for that. So, uh, a lot of us in med school have no clue what we want to do. Can
Yeah.
you tell us why or how did you choose to become a hospitalist? And then you can also touch base on the typical training path to get there as well.
Yeah. Um, I didn't know anything about being a hospitalist in medical school, not until probably residency or shortly after residency. I knew that I wanted to go into something like related to internal medicine and pediatrics. Early on, after my first year of medical school, I did a summer externship in pediatrics, and that's where I first met a resident who was med peds. And the more I thought about med peds, I was like, this totally makes sense for me, because then I get the depth of learning everything in internal medicine. I get the depth of learning everything in pediatrics. And for just an extra year of residency. Normally residency in internal medicine is 3 years. Normally residency in pediatrics is 3 years, but combined med peds is just 4 years. So I thought, well, shoot, I can spare an extra year and learn both medicine and pediatrics in depth. So that really appealed to me. I liked that the specialty, either medicine or pediatrics, there's a lot of breadth and there's a lot of depth as well too. So you get to know a lot about a lot of things. When I did my rotations in other things, it seemed like other specialties were focused on just one small area of the body, and that's it. Which I think that's appealing. But I was the kind of person who liked to know a lot about a lot of things, and so that's why I chose med peds. A lot of the training, at least when I was in residency, a lot of the training was really hospital focused. I mean, we did do a lot of outpatient stuff. We did have our own continuity clinics, but I felt a lot more comfortable with things in the hospital, with treating patients in the hospital. So as I came out of residency, really some of my first jobs as locums or temporary jobs were hospital based, and so I really got more and more comfortable with that, and decided to formally then become a hospitalist.
Cool. So what other specialties besides med peds were you considering and up not doing during medical school?
I was thinking about radiology like a long time ago. So prior to medical school, but my parents were really worried about all the radiation exposure. And I tried to calm them down about this. I did volunteer work even in high school in a radiology department, and they weren't into that. So I was like, okay, well.
What characteristics and qualities make for a successful hospitalist?
Yeah, great question. I think probably the most important quality in a hospitalist is interpersonal skills,
Mm-hmm.
not only with our patients, but also with family members, with colleagues, with nurses, ancillary staff, etc. Um, we are constantly explaining and interacting with patients, explaining like their medical conditions to patients, in patient-friendly terms, explaining the
Mm-hmm.
importance of continuing to take care of themselves outside the hospital. We're constantly reaching out and um, reaching out and talking to family members about the conditions of their family members,
Mm-hmm.
realistic expectations. Um, so these are, I think, are really important skills to have. I mean, also, we're interacting with colleagues as well as nurses
Yeah.
and other ancillary staff too. So we're all a team. We all work together. So having these interpersonal skills, hard to train, but very, very important to have. Another important characteristic and quality would be leadership.
Mm-hmm.
Whether we know it or not, as physicians, we are leaders. Um, we are leaders um, of our care team, um, but also the rest of the hospital kind of looks to physicians for leadership as well too, leadership and expertise. And so I think that was one thing that um, one big thing I actually did not realize in medical school. I focused a lot on the training of my medical training, academics, reading and stuff. But leadership skills is, is something that's very important that I don't think we got, at least we didn't get formal training in. We kind of got on the job training on that.
All right, great, great.
Yeah.
Thanks for that. So, what do you find the most exciting, or like the most regarding the hospice job?
Yeah. I certainly love the variety of medical conditions that I get to take care of. Um, I mean, some of the bread and butter things that we take care of are patients with congestive heart failure,
Mm-hmm.
COPD or emphysema, um, atrial fibrillation, diabetes, a whole bunch of GI related stuff. So a lot of different things. Um, I really like the fact that as I'm treating patients, I see the results immediately. So if I give them a nebulizer treatment, I see that that actually worked or didn't work. I can
Mm-hmm.
give them IV fluids and I can immediately see the impact of IV fluids. And I can immediately make changes right away. Um, I think it's, on the flip side, I think it's challenging for, I don't know how primary care doctors do it, like where you try a treatment and then you don't find out months later
Yeah,
whether it worked or not. I'm
yeah.
more the kind of person who likes to see something, make sure that the things that I'm doing, uh, that I'm on the right path, or I can make a quick course correction if needed. So that's also one thing that I find exciting about being a hospitalist. Um, I like that I actually have time to think about my patients and read up on my patients um,
Mm-hmm.
during my job, actually. So if there's something there's something I don't know, there's actually a lot of things I don't know, but I have the time to sit back, take a couple minutes, read up a little bit on the patient's medical condition, and be able to do that. I'm not scheduled to say like, okay, I only spend 10 minutes for this first patient, 10 minutes on the next patient, 10 minutes on the next patient. I'm
Mm-hmm.
not bound by such a strict schedule in each day. As long as
Mm-hmm.
I see all my patients during the course of the day, I can divide it up as how I want. So I like the flexibility of my schedule during the day and the ability to read up on my patients. Um, I like that being a hospitalist, my role is actually kind of in between primary care and the ICU. And luckily at the hospital I work at, um, our ICU is an open ICU, which means that hospitalists can take care of, and often do take care of, um, patients who are in the ICU, in the intensive care unit. Um, the sickest of the sick certainly get taken care of by the intensivist, um, someone who specializes in ICU or critical care. But for the critical patients who aren't the sickest of the sick, at least we hospitalists at my hospital are able to take care of patients in the ICU.
Mm-hmm.
So my role, I kind of know some ICU stuff, and I know a tiny bit of primary care. So I kind of like that hospitalist. The hospitalist role is actually kind of in between the two. There's a lot of flexibility actually in my schedule as well too.
Mm-hmm.
There are some hospitalist groups that have like a 7 on, 7 off schedule, meaning that
Mm-hmm.
they're working in the hospital for 7 days, but then they also, which means they work hard during those 7 days, but they also have 7 days off. And so they
Mm-hmm.
so the 7 on, 7 off schedule is at least it's structured and predictable. You can look
Mm-hmm.
ahead and know that, well, um, uh, 10 months from now, if I want to take a vacation, I could say that I know that I'm off on those particular weeks. Um, our hospitalist group, we actually have a flexible schedule. So um, we tell our scheduler what days we want off for sure, and then they just plug it in and figure out the schedule there. So it's not a predictable 7 on, 7 off. But regardless, though, I like that um, I have a good balance of work life. Um, I like that it's quote unquote shift work. That when I'm actually off, I really am off. I have
Mm-hmm.
partners who cover for me when I'm not in the hospital. Um, if I'm uh, Once I'm done with all my shifts, my stretch of shifts, I hand off to my partners. Um, so I like that part of being a hospitalist as well. Um, and I guess probably yeah, so certainly a lot of things I like about my job.
Cool. Thanks for that. So on the other side of the spectrum,
Uh-oh.
what should students know if they're going into hospice? What kind of things do you dislike about it?
I mean, one minor thing that I might dislike, and it's really not a big deal, really, is, I mean, we're constantly rotating shifts. So our hospitalists, we have day shift rounders, we have swing shift, and we have night shift,
Mm-hmm.
which is great. You know, it gives us variety of like different shifts that we get to work. Um, but as I get older, man, these night shifts are really tough on my body,
Yeah.
and uh, especially when we're switching from a day shift a few days ago and then being scheduled to do night shift.
Mm-hmm.
Night shift meaning like 7 p.m. to 7 a.m. So I'm up all
Mm-hmm.
night. So rapidly changing my sleep wake cycle is tough. Not only for I'm not sure we humans are supposed to be doing this, but it's tough for my body, but also I mean tough for family life too. You know, there are a lot of external forces that affect how I perform my job, re- or give me external requirements for my
Mm-hmm.
job. So everyone blames Medicare, or there's always like regulatory changes about things that I need to do um, to prove my work. Um,
Mm-hmm.
what what sort of documentation requirements do I need to? What do I need to add in my progress notes to ensure that I get credit for the work that I actually did? Um, Different payers have requirements as well too. Uh, there are always core measures or quality metrics, either from the hospital or national quality metrics that everyone is pressured to meet, whether we
Mm-hmm.
agree with those quality metrics or not, or whether we agree on how well these measures are actually being measured.
Mm-hmm.
Sometimes they're measured in a way that wouldn't pass a scientific paper, and yet we have no say in how these measures are actually being measured.
How has the hospice, have you seen any changes with COVID-19?
Our census actually dropped a lot um, during the time of COVID for some reason. Um, People weren't coming to the emergency departments as often as they previously were, and that means people weren't hospitalized in the hospital as often as they were. Certainly, the people who were in the hospital were super sick; they needed to be there.
Mm-hmm.
But that kind of scratched our heads too, because we were wondering, well, normally we would see folks with chest pain. Normally we would
Mm-hmm.
see people who had bad diabetes or
Yeah.
bad heart failure or bad COPD. But yet with the decrease in patients coming into the emergency department, with a decrease of patients being hospitalized, where are these patients?
Yeah.
Are they, hopefully they're not suffering at home,
Yeah.
or waiting till the very last minute before coming to the emergency department, coming to the hospital. So we've been struggling with low census, which also translated to staffing as well too. Staffing for
Mm-hmm.
nurses, staffing for physicians. Are we overstaffed relative to the smaller census? Also initially canceled all elective surgeries. That was a huge
Mm-hmm.
source of like hospital reimbursement.
Mm-hmm.
Um, and so because of that, I think all hospitals, including ours, ha- are facing huge like financial difficulties and financial challenges um,
Mm-hmm.
because of COVID-19. Ironic, because we're the ones taking care of COVID-19 patients, and yet because of all these measures, we're also facing financial challenges because of it too.
Yeah, it's the irony in the situation, right?
Yes,
So,
yes.
what changes do you see in the specialty in 10 to 20 years?
So I think as things continue to grow, maybe hospital medicine might become its own specialty, or might become its own subspecialty actually. Probably increased focused on quality, and for us hospitalists, our biggest quality measures are length of stay,
Mm-hmm.
and of our patients, and readmissions. So as I discharge a patient, how often are patients then turn around and come back to the hospital and are readmitted within 30 days. So those are big hospitalist quality measures. There will be more and more focus on value-based care and care transformation. And what that means is currently um, hospitals are paid. Um, the more people who come into the hospital, the more we get paid. All right.
Mm-hmm.
The more we do surgeries, the more we get paid. But I think there's actually going to be more focus on keeping patients away from the hospital, improving the health of our communities.
Mm-hmm.
And so, how do we improve the health of our communities so that they don't have to come to the hospital as much? And
Mm-hmm.
so, how do healthcare systems um, stay in business by keeping patients away? Kind of a backwards way of thinking, but I think that makes
Yeah.
sense for the community and for our patients. So there's going to be increased focus on that, I think, in the future.
It seems like the job market for being a hospitalist or adult medicine hospitalist is still growing. Is that correct?
I think the job market is extremely promising, or actually is extremely good for hospitalists,
Mm-hmm.
but especially good for nocturnists.
Yeah.
So nocturnists are people who only want to work in the hospital just at night. Um, there was a time when my hospital group had two nocturnists. And
Mm-hmm.
so those nocturnists, they worked 3 nights a week. So with two nocturnists, that was 6 nights that they covered, leaving
Yeah.
only one night out of the week that the rest of us had to cover. That
Mm-hmm.
actually was pretty good. Um, so if you're willing to stay, willing to be up in the middle of the night, change your sleep-wake cycle to work only at night, there's a huge job market available to you as a nocturnist. But in general, though, hospitalists I see are in high demand.
Cool. What resources uh, can they find to learn more?
Yeah. There's a Society of Hospital Medicine. That's the formal organization
Mm-hmm.
for all hospitalists, adult hospitalists, pediatric, et cetera. So that's actually been a growing group over the past like decade.
Mm-hmm.
And and they have annual conferences as well too. So, start by going to the Society of Hospital Medicine website, learn about hospital medicine. Excuse me. If you have the ability to go to a conference, to Society of Hospital Medicine conference, I think that would be very eye-opening too.
What's your number one tip to students who want to go into to become a hospitalist?
And not just as a hospitalist, but also for any specialty, make sure you have good work-life balance. And work-life balance, good work-life balance means different things to different people. But
Mm-hmm.
whatever specialty you go into, just make sure that you have a good work-life balance for you. I think probably one last thing that I learned kind of along the way is that one way to kind of stand out, if you wanted to stand out, is to combine things that you're interested in.
Mm-hmm.
And I think that kind of makes you unique. I had an early interest in computers as a kid,
Mm-hmm.
and I've always tinkered with computers and programming and stuff on the side. And so I combined computers and medicine. And I did a fellowship in medical informatics, and
Yeah.
so and now part of my work actually is in clinical informatics at my hospital.
Yeah.
Um, or if you're into or if you are really good at leadership, you can take charge. You are good at um, rallying people around a central cause, doing good with change management, combining medicine and leadership. There's plenty of opportunities for physician leaders in any field. So combining those two skills will make you stand out.
Yeah, I appreciate Charlie for volunteering your time, and
Yes.
definitely your knowledge is invaluable for students who want to
Yeah.
learn.
Yeah.
So, all
Yeah, I
right.
hope it's useful. Thanks again for inviting me to chat with you and to all the
Yeah.
students out there.
Yep.
Con.
All right. Thanks.